I'm Dr. Brian Koffman, a retired family doctor and a CLL patient myself for almost 2 decades now. I'm also the co-founder, executive vice president, and chief medical officer of the nonprofit CLL Society. For those of you who may not be familiar with the CLL Society, let me introduce the organization to you. The CLL Society is the leading global nonprofit that's dedicated to supporting individuals impacted by chronic lymphocytic leukemia, CLL, and small lymphocytic lymphoma, SLL, the most common forms of adult leukemia. Founded by patients and care partners, for patients and care partners, CLL Society serves as the trusted resource for all, ensuring that they have the knowledge and resources needed to navigate every stage of their disease. CLL Society does this through addressing the 4 main pillars of our work: support, education, advocacy, and research, to help meet the unmet needs of all of those affected by CLL or SLL. By connecting patients, care partners, health providers, and researchers through our website and all our activities, CLL Society is transforming the future of CLL care, ensuring no one has to face this disease on their own. Our motto from our earliest days remains: smart patients get smart care. I'm going to focus on one particularly dangerous, though fortunately rare, complication in CLL, and that's warm autoimmune hemolytic anemia, sometimes abbreviated to WAIHA. This is a rare autoimmune disorder where the immune system attacks the blood. It produces antibodies. For those interested in more details, it's usually immunoglobulin G, that targets and destroys our own red blood cells at normal body temperature, about 37 degrees Celsius. It's the most common form of autoimmune hemolytic anemia, accounting for 70 to 80% of the cases. Symptoms include being pale, fatigue, even jaundice, dark urine, and an enlarged spleen. In CLL, warm autoimmune hemolytic anemia is the most frequent autoimmune complication that's seen. Approximately 80% of the autoimmune hemolytic anemia seen in CLL is the warm type, the remaining 20% being cold, agglutinin disease, or mixed disease, which is beyond our discussion today. The incidence of autoimmune hemolytic anemia is variable depending on how you look at it, what different kinds of studies you use. It ranges somewhere as low as 5% and as high as 25% in some studies, depending on where the patient's at in their disease course. It's more common in those with more aggressive disease with unmutated IgVH, adverse cytogenetics, such as deletion 17p and 11q, in patients who have in the past received fludarabine, which is a form of chemotherapy, part of FCR, which is no longer used as much. The prevalence of autoimmune hemolytic anemia is approximately 2% in early stage CLL, and sometimes can be the first symptom that people have being diagnosed as CLL, but it can go up higher to almost 10% in more advanced stage. Autoimmune hemolytic anemia is associated with a poor prognosis and can be difficult to control in CLL. Therapy often includes suppressing the immune system that is attacking the red cells, and this is done with corticosteroids, drugs like rituximab, and even with targeted therapies like the new BTKI inhibitors. CLL is a cancer of the immune system. This means not only is our immune system deficient, it can be dysfunctional. Warm autoimmune hemolytic anemia is one of the complications that can be seen in CLL and needs to be recognized and appropriately managed. Thanks for your attention. You can find a lot more information on autoimmune hemolytic anemia in CLL at the CLL Society's website, cllsociety.org.